What does informed consent for Pristiq, otherwise known as desvenlafaxine, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So one of the medications that has been requested is Pristiq. So Pristiq, otherwise known as desvenlafaxine, is the active metabolite of venlafaxine or Effexor. And so both of these medications are SNRIs, meaning that they selectively inhibit the reuptake of both serotonin and norepinephrine. So desvenlafaxine, being the active metabolite of venlafaxine, theoretically should have several benefits over venlafaxine. So these include things like being less likely to cause elevations in blood pressure, being less sedating, as well as less likely to cause weight gain or sexual side effects, less nausea and GI upset. Additionally, because it's the active metabolite, it has less activity on the CYP2D6 liver enzyme, and so that just means that there's probably fewer interactions with other medications. In contrast to Effexor, it's only FDA approved for use in major depressive disorder, but it certainly has a number of other off-label uses, things including generalized anxiety disorder, premenstrual dysphoric disorder, perimenopausal hot flashes, postpartum depression, neuropathy due to diabetes. So just like the other SNRIs, there is going to be some pain relieving effect for some. And along those lines, it can also be used for fibromyalgia off-label. And although there may be less risk of side effects, there certainly are the potential of all the same side effects. So things like nausea, GI upset, constipation, diarrhea. We're still going to recommend taking this with food to help mitigate those effects. It's less likely to cause sedation, but of course this can happen. But because of that norepinephrine effect, some people are going to experience activation or insomnia. There is the risk of triggering mania in those who may be vulnerable to this. There can also be things like headache, dizziness, fatigue, tremors, increased sweating, dry mouth, changes in appetite, as well as sexual side effects. And although it's slightly less likely to cause elevations in blood pressure than venlafaxine, this still can happen. So it's important that your prescriber is monitoring your blood pressure. There's also going to be a slightly increased risk of bleeding. Other adverse effects include things like suicidal ideation. There is still a black box warning for the use of this medication, particularly in adolescent populations, due to the increase in SI. Additionally, there's the risk of serotonin syndrome, especially if this medication is taken in conjunction with other serotonergic agents. For those who have narrow angle glaucoma, there is the risk of acute angle closure glaucoma, which is a very dangerous condition that can lead to blindness. There can also be hyponatremia or low sodium levels, and it does decrease the seizure threshold. Like all antidepressants, but especially the SNRIs, there is the risk of withdrawal symptoms. So coming off of this medication can be quite challenging, and so we're generally going to recommend a hyperbolic taper, meaning decreasing by a percentage of a dosage rather than a set amount, and decreasing at only the rate at which the patient is able to tolerate, which can be quite slow in some cases. If this approach is not taken, then there is the risk of protracted withdrawal, which can lead to a whole other host of symptoms. Check out some of my other videos on that. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list so that I can share resources, and in case I have future courses or things I want to offer, I want to be able to communicate directly with you all. So if that's you, send me a DM with your email, and I'll see you in the next one.